If their blood glucose is less than 30, we want to recheck the bedside glucose and send a serum level to the lab. If they're asymptomatic, we proceed with the normal IV fluid and feeding. If they are symptomatic, we're giving IV glucose. The usual dose for that is 1 to 2 mLs per kilogram, and then we will proceed with the normal IV fluid and or feeding and recheck again in 30 minutes. Term or late preterm infants, blood glucose levels of greater than 45. We're going to feed as mom had planned, so hopefully they'll be putting those babies to breast, and we'll continue to monitor the baby. Blood glucose levels between 30 and 45. If they're asymptomatic, we're going to be encouraging mom to breastfeed, and again rechecking it 30 minutes after the feeding. And I usually go with 30 minutes after the feeding began, because moms can breastfeed for hours. Blood glucoses of less than 30, rechecking a serum level and feed if asymptomatic, and if they're symptomatic, we're going to be giving the IV glucose again, usual dosage 2 milliliters per kilo. Special considerations for late preterm infants. So we want to look at mom's history, thermoregulation of the infant. Are they using up that extra glucose levels? Are they having feeding difficulties, again, where they'd be utilizing their energy expended when they're eating? And if they're hypoglycemic, we may need to supplement a little bit sooner, or think about supplementing them a little bit sooner than their term counterparts. Alrighty, so this little cutie. Recommended feeding in the asymptomatic infants. Breastfeed early and often, usually immediately after birth or within the first 30 to 60 minutes, and these are baby-friendly recommendations. Another big baby-friendly recommendation that we've been seeing is to avoid scheduling of breastfeeding. So all of their books are going to say infants should be eating every 2 to 3 hours. We're going to encourage the on-demand feeding and check again until the blood glucose is stable. Benefits of exclusive breastfeeding. Breast milk is the best nutrition for an infant. Immunity protection is especially important in those hospitalized infants. Mothers who get the flu shot will also pass that protection on to their babies. Those babies usually aren't recommended to get the flu shots until they're at least 2 months old, so this is extremely important. Infants who are exclusively breastfed have a 36% reduced risk in SIDS. They're also at reduced risk for infections, ear infections, gastroenteritis. We see in necrotizing enterocolitis, RSV, pneumonia, urinary tract infections, and sepsis. And the main immune factor here is the secretory immune globulin A, and that's something that's only found in breast milk. It's in higher concentrations in colostrum, so even a drop swabbed in a baby's mouth that's NPO would be enough to get this baby going with that immunity protection. And this guards against invading germs by forming a protective layer in the mucous membranes in the baby's intestines, nose, and throat. Breastfeeding benefits for the mother. They're going to be losing that baby weight faster. It helps promote bonding. It reduces the risk for depression and stress and lowers their stress levels. When the mom and baby are skin to skin or breastfeeding, oxytocin is released from the posterior pituitary in the mother and the baby's brain. Oxytocin mediates the release of other hormones and factors in the gut of the newborn and submits a central nervous response. Also, another just tidbit of information is that autistic individuals have low levels of serum oxytocin. And they did a study that showed that an oxytocin infusion to adults and children did temporarily reverse some of their autistic symptoms. Breastfeeding for the mother will also reduce the risk that she will develop type 2 diabetes later on. They'll also demonstrate a reduced risk for ovarian and breast cancer, and it's environmentally friendly. So we're reducing our carbon footprint by not having those formula packaging being tossed into the landfills. The long-term benefits of exclusive breastfeeding are reduction in the rate of childhood obesity, a 4% decrease for every month up to 9 months, so a total of 36%. Children at ages 5 and 6 are 18 times less likely to be obese, and age 9 to 12 are 22% less likely. They have a reduction in the rate of type 1 and type 2 diabetes, reduction in the rate of hypercholesterolemia, up to 14% lower levels in children and young adults who've been breastfed than not. They also have a reduction in the rate of cardiovascular disease, up to 35%, reduction in the rates of hypertension, reduction in the rate of leukemia, reduction in the risk of juvenile rheumatoid arthritis, reduction in the incidence of allergies, improved cognitive development. The cost savings can be between $1,200 and $1,500 just on formula, and it also reduces the risk of having children who get cavities. Okay, so feeding the asymptomatic infant of a diabetic mother. That first colostrum has the highest level of glucose and may be given by spoon or dropper if the mom is pumping or hand expressing. Breastfeeding is not contraindicated for most hypoglycemic infants. However, it may require the support of a lactation consultant and possible supplementation, especially if they have to be separated from their infant. It's really important that we get the lactation consultants on board and get a pump over to that mom so she's able to be getting that milk going. Due to lethargy and feeding difficulties, there's a need for optimal intake, and it may be necessary to do gavage feeding while the mother uses a breast pump to establish and maintain her milk supply. Glucose water is not recommended in these infants to get their blood glucose higher. It's absorbed rapidly by the GI tract and can stimulate the release of insulin, which may further worsen the hypoglycemia in these infants. If oral and gavage feedings are not tolerated, or the infant's blood glucose level drops to a level less than 40, parenteral treatment may be indicated. Treatment for symptomatic infants. If the baby has hypoglycemia despite feeding, has a low birth weight, or is preterm, IV glucose administration is best accomplished with a peripheral IV catheter. Due to the likelihood and danger of infiltration into the tissues, central access is required if glucose concentrations are greater than 12.5. Initial treatment includes 2 milliliters per kilogram D10W, 200 milligrams per kilo per dose. And that would be followed with a 4 to 8 milligram glucose per kilo per minute IV rate. We don't want to delay treatment in these infants if we know we don't want to wait for the lab results to come back to start treating their hypoglycemia. Oops. We're going to measure their blood glucose level every 15 to 30 minutes until glucose is stable and above 40. Observe your IV site frequently and treat loss of IV access as an emergency. Reactive hypoglycemia may follow a sudden interruption of glucose infusion. And we want to begin the oral feedings if not contraindicated monitor plasma blood glucose and decrease glucose infusion concentration as tolerated oral feeding volume increases. So what are post-neonatal complications? These kids have high risk of metabolic syndrome, and this is an identifiable early precursor to adult chronic diseases including diabetes, heart disease, neurological sequelae of hypoxic episodes, certain cancers, and others, such as childhood obesity, glucose intolerance or carbohydrate intolerance, dyslipidemia, hypertension, and of course the predisposing factors are infants who are of a diabetic mother, infants of an obese mother, and infants who are large for their gestational age. I put in some links here to some great patient education material, and this is available on the CDAP Sweet Success website. I also put in the link here for easy access to the Sweet Success Guidelines for Care. The third link here is the guidelines for diagnosis, and it's almost like an algorithm for diagnosis of hyperglycemia during pregnancy, and then some other useful links down at the bottom there. So a study was done back in 1992 on our program, California Diabetes and Pregnancy Program. The benefits of prevention of diabetes, and this is where I got the statistic earlier, is that hospital charges were about 30% less for program participants, and the days spent in the hospital by our patients were roughly 25% less. The program effects were, of course, larger for women who were enrolled before 8 weeks gestation. And again, for every dollar spent on your prevention education programs, approximately $5.19 is saved. These are my references. And then we'll open it up for some questions.